health seems to be a topic that everyone has an opinion on, and one of the biggest topics in mental health is antidepressant use. There are three common objections that people seem to raise. Firstly, that they simply don't work. Secondly, that they're being overprescribed. And thirdly, that they change who you are and so shouldn't be taken. I'm going to respond to each of these criticisms, but let's clarify our terms a little. There are many classes of drugs that have an antidepressant effect. The three broad categories are the older or first generation drugs, which include monoamine oxidase inhibitors or MAOIs, and the two newer categories of selective serotonin reuptake inhibitors or SSRIs and serotonin norepinephrine reuptake inhibitors or SNRIs. The last two categories became well known in 1980s, particularly with the development of Prozac. The majority of criticism is levelled at SSRIs and, to a lesser extent, SNRIs. So I'm going to focus on those. The first criticism that is levelled at antidepressants is that they don't work. Now, there are a number of claims that people make here. It's claimed that the evidence for their efficacy is vastly overstated, usually due to the influence of big pharma on the publication of research, and in reality that they're no better than placebo. Another related claim is that most people who take them experience little benefit and that doctors will just keep prescribing different drugs in a trial and error fashion. Now, both of these criticisms have some merit. In the last 5 years or so, there's been a strong effort to reevaluate the evidence for SSRIs and SNRIs as the medical community has become aware of the various ways in which publication bias has skewed the research. However, the results of these analyses is that while the initial claims of effectiveness were inflated, there is still good evidence that antidepressants do work. The current guidelines, taking this new research into account, is that while there may be little or no benefit for people with mild depression, for those with moderate or severe depression, there is good evidence of benefit. On the claim that most people aren't helped, the best evidence is that across the board, roughly 1/3 of patients will experience a complete remission of depressive symptoms when taking these medications. This means that someone with moderate or severe depression has a 1 in 3 chance of making a complete recovery simply by taking antidepressants. Also, a further 1/3 of people will experience some alleviation of depressive symptoms from taking antidepressants. So this means that only 1 in 3 people will not experience any improvement. Now, while this is cold comfort for those who are in that category, the situation is better than many will suppose. The second major criticism is this idea that they're overprescribed. The claim is often made that big pharma are pushing to have antidepressants prescribed for a wide variety of other conditions, and that the DSM has medicalised sadness and other natural states of affairs, and that people attending their GP with other complaints are frequently being diagnosed with depression and given antidepressants. Now again, there is some merit in these criticisms. Since drug development is very expensive, drug companies are looking to maximise their profits by finding new uses for drugs that they've already developed. And also, each revision of the DSM, that is the main book for diagnosing psychiatric conditions, includes new conditions and often less restrictions on the diagnosis of depression and other disorders. And yes, many more people are being diagnosed with depression, and SSRIs are prescribed much more readily than the older antidepressants. To try and defend the DSM would take a whole other video, and I don't have time here to do that. However, I will defend the changes to the diagnostic criteria for depression. In the most recent version, the bereavement exclusion was removed, which has been controversial. What this was is, up until 2013, a person could not be diagnosed with major depressive disorder, clinical depression, for 2 months following the death of a loved one. The argument here was that the normal grief process was indistinguishable from depression, and so diagnosis was inappropriate. This exclusion was removed in the most recent DSM on the basis that normal grieving and depression are actually quite different. While both may well include intense sadness, the diagnosis of depression includes a range of other symptoms. And in fact, one of the most common misconceptions of clinical depression is that it is simply feeling very sad. The other concern was that people who were susceptible to clinical depression may well have a depressive episode triggered by the death of a loved one. And since they would not be able to be diagnosed, they would likely be unable to access treatment for the 2-month exclusion period. Now, for someone who may be intensely suicidal, this was a potentially dangerous situation. To understand a surge in antidepressant prescription, we need to consider the costs and benefits of their use. Whenever a drug is prescribed, a cost-benefit analysis is made between the likely medical benefit and the potential harm from side effects. The key to understanding why SSRIs are so commonly prescribed is to realise that their side effect profiles are actually very, very good. The majority of their adverse effects are simply unpleasant rather than harmful. And of the harmful side effects, the non-psychological ones are actually very rare. So the only real cause for concern is the possible increase in suicidality. However, the other positive about the side effects of SSRIs is also that most people only experience them for the first 2 to 4 weeks, after which they tend to subside. That's the cost side of the equation. What are the benefits? Well, suicide is one of the leading causes of death in young and middle-aged people. One of the biggest risk factors for suicide is untreated depression. And so one potential benefit of prescribing an antidepressant is preventing an avoidable death. The side effects of antibiotics are at least as bad as antidepressants, and few people would hesitate to take an antibiotic, even for non-life-threatening conditions. Given that antidepressants have few terrible side effects and treat a potentially life-threatening disease, it makes sense for them to be readily prescribed. Now, the final argument against antidepressant use is the idea that taking them alters who you are as a person, or that you will lose your emotional spark and become an emotionless zombie. Now, these concerns come from the fact that any psychiatric medication is expected to change the mental functions of the patient. And this essentially means that their personality, and even possibly who they are, will be affected. Pretty much the definition of mental illness is that it affects a person's basic personality, or who they are. So any medical treatment is expected to change this. This is also true for other treatments for depression. While the changes from psychological or counselling treatments are not as sudden, successful treatment generally means that the patient's personality changes, often radically. The suddenness of antidepressant medication makes this much more noticeable, but plenty of friends or family of people in therapy are also bothered by the changes in personality that they notice. The real question in all of this should be, is the patient better off with the changes or worse off? Now, this is not always easy to answer in abstract, but since antidepressants are non-addictive and their effects are generally reversible, it really is almost always worth trying them. Now, before I finish, I want to talk a little bit about my own experience with antidepressants. I think that it's important to share our personal experiences with mental health issues, particularly to help destigmatize mental disorders. I've had depression for almost all of my adult life. While I was diagnosed only a few years ago, I've had the condition since at least my middle teenage years. Since being diagnosed, I have taken 2 different antidepressant medications and I've had extensive psychological treatment. The result of all this is that I have made a full recovery and am no longer depressed. While my use of antidepressants was not sufficient in itself to alleviate all of my symptoms, it was instrumental in my recovery. In particular, it improved my condition sufficiently that I was able to engage in therapy, which I otherwise would have not have done. In all, while the value of antidepressant medication does not rest on my personal experience, I am one of many people for whom it has been crucial in my recovery.